Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala barakatuh. Alhamdulillah. Alhamdulillahi rabbil alamin. Wassalatu wassalamu ala asyrafil anbiya wal mursalin wa ala alihi wa sahbihi ajma'in. Alhamdulillah. In the previous video, I have explained to you the practical application of cognitive behavior therapy and how we're going to actually enhance CBT through CBT to tackle the problem of psychiatric disorder, psychological and psychological problems and disorder, a medical problem with psychological components that is now very rapidly growing throughout modern society, especially all this that we have mentioned here. That's the reason why CBT needs to go to another level, because there are a lot of success in CBT, but there are so many failures now that they find that the whole idea of just CBT alone will not be sufficient. But again, we don't start reinventing the wheel. So my approach towards Islamic psychology is to use all the good modalities that is available in the arena of psychology, because we Muslims in the 20th and 21st century have lagged behind in terms of developing this ilmun nafs, which is we should be on the forefront, but regardless of the situation, we can leapfrog by developing a model, just like we have developed, Professor Mahdi Jenkins and myself, we have developed this Islamic psychology model that we are trying to present as one alternative in the Muslim world. That means there will be more, maybe 10, 20, 30 models developed by different psychologists, or Muslim psychologists, or Muslim universities in their research, in their development, and then we can come to a via media, a middle ground, which model would then most reflect the ideals of Islam and the principles of Islam. So today I'm going to talk to you again this principle of, there are basic principles of CBT, 10 principles of cognitive behavior therapy. If you go to any CBT book, you will have these 10 principles. These are outlined, and I will show you some video explaining this detail. Again, a lot of this idea is consonant with Islam. There's nothing wrong with it. So what we do is we apply these principles and modify. Add one or two more principles, or remove one or two more principles, or make it 10 or maybe 12, whichever idea that we can develop, so that we have a good basis in terms of positive Islamic cognitive behavior therapy. So the first principle of CBT is based on ever-evolving formulation of patient's problem and individual conception of each patient in cognitive terms. So again, I have explained to you, they take care of the cognitive aspect. That means aspect of the brain, aspect of the neurology, aspect of the self within the context of a godless society. They don't believe in even mindfulness, because the aspect of mindfulness came later, because that's where MBCT come in, mindfulness-based cognitive therapy, and DBT and the other offshoot of CBT. So this is the first principle, which we can actually then, and for this same principle can be used, we can say that cognitive behavior therapy or positive Islamic cognitive behavior therapy, CBT, is an ever-evolving formulation of patient's problem and individual conception of each patient in cognitive, mind, heart, and spiritual terms. So we just add a few more words and it becomes Islamic already. All right. The second principle is cognitive behavior therapy requires a sound therapeutic alliance. So there must be a therapeutic alliance, and this is where we lack. So CBT needs a tremendous amount of therapeutic alliance, applying what we have. There's so many range of therapies which I explain to you later in the next video, but at least applying what is good and then upgrading so that we absorb the best of all psychological tools, protocols, techniques that we can apply in CBT. The third one is cognitive behavior therapy emphasis collaboration and active participation. That means active participation for the counselor and the counselee. The person with the problem, they must work together in active participation as equal. Number 4, cognitive behavior therapy is goal-oriented and problem-focused. That is very good. We can use that, and inshallah. So CBT must be based on goal-oriented and problem-focused. Number 5, cognitive behavior therapy initially emphasized on the presence. So this whole idea of being in the presence now is even better, because now we are talking about mindfulness. We got to live in the presence. What is the past is the past, what is now, and what is the future is. And so there's no rumination into the future, or reflection, negative inner speech of the past. So we have to try to bring about living in the present. Number 6, cognitive behavior therapy is educative aims to teach the patient, which is good. So CBT must be educative. We must aim to teach the patient that whatever problems that they have in terms of their psychological or psychiatric problem, which they go through the whole modality, whether it is drug-based plus therapy or just therapy alone, is something that they can slowly outgrow through education. So the patient can be his or her own therapist and emphasize on relapse prevention. So to prevent this whole idea of relapse in terms of anxiety, depression, suicidal tendencies, self-injury, infliction, and so on. So all those things we can actually teach them through the idea of the holistic nature of CBT. That means in terms of how to develop a spiritual presence, an emotional presence, an akal or a mental presence, and a physical presence that will then balance this negative speech or automatic thoughts towards more balanced, more calm, peaceful way. All right. Number 7, cognitive behavior therapy aims to be time limited. We cannot go on therapy forever and ever, so there is time limited. All therapy has a time limit, so we have to have some sort of time where we can interact and then slowly bring the idea that the person would not need any more therapy, but through the techniques and tools given to them, they will be able to lead a normal life. Number 8, CBT sessions are structured. So we have a structure. We have forms, we have formulation, we have diaries, we have tools that we structure. We just don't go around talking, just rambling over. No, this is structured. Again, CBT must also be structured, but not the very heavy duty structure, because sometimes you got to give leeway, and later on when I explain our principles of CBT, which is different, our technique or our tools, later on we will then improve on that. Number 9, cognitive behavior therapy teaches patients to identify, evaluate, and respond to their dysfunctional thoughts. So they must be able to go backward, being an observer to see what are the dysfunctional thoughts, what are the things that cause depression or anxiety, or causing them the phobia or the difficulties in life that they face, as an observer looking from outward, inward, and slowly learn the tools of seeking a balance of synergy, as I mentioned to you, spiritual, emotional, mental, and physical synergy, integration, and coherence. Number 10, cognitive behavior therapy uses a variety of techniques to change thinking, mood, and behavior. For CBT, uses a variety of techniques to change thinking, mode, and behavior, as well as the spiritual reality of at SEMP, spiritual, emotional, mental, and physical level, through a progressive development through gentleness, kindness, forgiveness, mercy, compassion, so many things which are standard application based on the Quranic injunction, based on the seerah, the life of whole Prophet Muhammad Sallallahu Alaihi Wasallam. So beautiful, he reflected. In fact, if you want to take a psychologist, if you see how strategically he's applying the whole psychological principle for the ummah, that everyone, even his worst enemy, is attracted to him. So that can be reflected upon the sunnah of whole Prophet Muhammad Sallallahu Alaihi Wasallam. So those are some of the basic idea. I'm going to show you one video, and from here we can at least enhance our understanding of the basic principles of CBT. Very important. This is the foundational tool that you must know. If you are going to become a certified coach, life coach, at least you know some of these ideas, and then also reflect on what others have spoken, and then you can formulate your own principles based on your own understanding, inshallah.
What we do and why we do it in CBT. So the first one is CBT is based on an ever-evolving formulation of the patient and his or her problems in cognitive terms. So we're constantly looking at at the patient as he or she evolves in the treatment. We're looking at current thinking, problematic behaviors, precipitating factors, that's different in each situation, developmental events, and we'll talk about that when we get into the core beliefs a little bit, and enduring patterns of interpreting. So the way that we interpret events, we have patterns of the way that we attach meaning to certain things. So we're constantly looking at that every single session all along the way, and we believe that this develops and evolves over time. So a CBT requires a sound therapeutic alliance. Okay, so this is really, really important in CBT, just like it is in most other therapies, right? We say that in CBT, it's a relationship of equals between the client and the therapist. There's no hierarchical kind of value based on the relationship, and we really work as partners together. So again, like I said, it really emphasizes a collaboration between the client and the therapist and active participation, especially so in the beginning, maybe the therapist might be a little bit more active, but then as the sessions go on, the therapist will kind of wean herself back, myself or himself back, and the client will begin to do more and more, okay, and so become more and more independent. It's a very goal-oriented and problem-focused therapy. We're constantly looking to change behaviors and change cognitive patterns in order to be able to change mood. So it's not very process-oriented. We're constantly looking to make changes. It initially emphasizes the present. So a lot of other therapies, and maybe some of the therapies that you guys are in the practice of doing. So, and you know, there is a place in CBT for this. There are a lot of myths about CBT that it's not emotional enough, it's not compassionate enough. You don't look at kind of the beginning and how all of this stuff developed, but there is a time and a place. But in the beginning, when we're really trying to make some changes, it's very present focused. The reason we do that is we want to make some changes in the beginning so that we have some wiggle room, so that the client kind of is moved a little bit outside of their current emotional state so that they can do the work and really go and look at the past and understand how all of this evolved. And we'll talk about that again when we talk about core beliefs. Cognitive therapy aims to be time limited. This is one of the differences, one of the big differences from psychoanalysis or psychodynamic therapy. We try to wrap things up by about 13 to 18 sessions, with then having them come in every other week and then maybe once a month, and then just calling in for booster sessions as needed. Now 13 to 18 weeks, that's kind of an average, and at the same time a lot of people do stay longer. I have clients who have done, for instance, they started with me doing DBT and then they transitioned into CBT, and then they did CBT for about 6 to 8 months, and then they started coming in once a month or once every other week. So that's just an average, and it really depends on what you're coming in with, of course. It's educative and it aims to teach the patient to be his or her own therapist. This is very, very important. So when they come into CBT, we give them like a toolkit, and we give them a kit, and we build on the tools that they can learn all along the way. And these are tools that they can do at any time. They could be at work and pull out a thought log, which we're going to go over, or they can sit down and do a responsibility chart really quickly to see, you know, and really check themselves and check their patterns of thinking. They can implement behavioral activation every weekend. So they walk away with tons of tools that they can implement and become their own therapist. We even teach them when they go into doing, coming in for sessions every other week or once a month, we have a whole termination opportunity to teach them how to become their own therapist and actually conduct their own therapy sessions using a worksheet. And it uses this agenda as well. So they sit down with themselves and they go through this agenda. They have all the worksheets they need, and they really do like an hour-long CBT session on themselves. So it's structured. This is the structure. They don't come in. It's very different from, you know, just coming in. I remember I used to do this. I'd go into my therapist's office. It was very psychodynamic. I'm surprised to this day. But because I'm such a CBT and DBT therapist, and everything I do in my own sessions is so structured. So, and I was used to it, and I'd go in there and I'd have no idea what to talk about because I was so used to kind of the structured format. So this is the structure. Clients come in, they do a mood check, they do a quick update on what's going on in the week. And in other therapies, especially for me, my update ended up being the entire session. But the update, we asked them to keep it to 1 to 3 sentences, actually. Sometimes most of the time, I actually give my clients a session bridging worksheet that I ask them to complete before they come in, so that this structure is in place and they don't have to think about how am I going to summarize this so quickly. And in the session bridging worksheet, they talk about, they give the brief update, and I really allow them only 3 lines so that they can't go on and on. I tell them do not go on the back of the page. And so that's why they're able to quickly summarize it. And it takes lots of practice, actually, so this doesn't happen overnight, especially if they're coming in from a different modality and they need to be reoriented to the CBT process altogether. We teach patients to identify, evaluate, and respond to their dysfunctional thoughts and beliefs. Okay, so this is where the C in CBT, cognitive behavioral therapy. We're looking at the cognitions, and we're looking at whether they're accurate, whether they're grounded, whether they're rational, and then we're teaching them how to actually go ahead and modify their cognitive patterns. And we'll do that. We'll look at the thought log today. And we use a variety of techniques. I'm going to go through some of them today, but there are endless CBT techniques. Some of them are cognitive, some of them are behavioral. Once you become, really seasoned at doing CBT, you come up with your own techniques, and so there are endless techniques to use to work on different things.
If you're watching this,
Alhamdulillah. We have seen a video on this whole principle of the 10 principles and how we can enhance our understanding through the development of CBT towards another level, as I mentioned, by CBT, which will be the Islamic model, integrating not only the cognitive aspect of our existence, but understanding the 4 aspects of our existence at the spiritual, emotional, mental, and physical level, and then developing the technique that we can mirror. A lot of the techniques, a lot of the tools, I believe, are so standardized, which is very good for us, so that we can apply it, modify as and when we need it, and then develop our own handbook. So inshallah, from these videos and so on, and from this talk that I'm giving, inshallah, we'll come up with a second series or third series of books, specifically on positive Islamic psychology, series 2 or series 3 on positive Islamic cognitive behavior therapy. The model, we have already the model, the principles, the tools, the techniques, the research that is required, and so on, so that inshallah, over the next many years, this can be one of the foundational handbook to help Muslim psychologists to find a way forward to development of a good psychological approach for the Ummah, inshallah, into the future. Thank you.